I'm Indian, so that shouldn't surprise you. See, I start off with wild gesticulations to stereotyping, but it's true in my case. And I applied to a place called Miami University. I thought I was going to Florida. I ended up in Ohio. So right away it was chaos, and I think that determines a lot of my work.
Fantastic.
You know, you start off with assumptions and you end up somewhere else. I was fed up with physics after a bit, and I was about to go home, and then got this job in education actually, teaching physics in a kind of a supplementary Teach for America program in New York for a summer, and ended up not teaching physics or math, but teaching, having lots of discussions about Black studies and Black history with my students, fourth graders at the time. So education has a role to play in all of this. Went right back and got my Black studies degree and women's studies degree, and that started me off into social work eventually, and it's where I am now. So it's kind of a circuitous route, and in many ways my research and the way I come to this is also kind of traces wildly crazy circuits. I grew up in India, in the community that I'm going to be speaking about here. But I grew up as one of the more, my parents were an intercaste marriage, so they were thrown out for that. I can talk about that later. But the point is that I had a foot in both worlds. I was in this world of sex workers that I'm going to talk about, which was my neighborhood, but I was also in the world of my dad's social capital kind of world, which was really upper caste and resource. So I ended up with an education, and an education in India means physics, math, etc. But I always wanted to come back to this community and to what I was, very familiar with growing up. And eventually I couldn't do it during my dissertation because I was told, as many of you will probably be told, that international research is very difficult and time-consuming, which it was. But I did it concurrent with my dissertation, which was on substance abuse in the US. And continued that work, and it kind of became my primary work over the years, and I've been able to do this more and more as I kind of continue or tenaciously hold on to education as one line of my career, so to speak. I went back at UCLA. This started at UCLA. Went back, got a little grant to go back and do this work, and I'll just quickly go through it. One of the articles that you have is the social science and medicine article is on this. So I won't spend too much time on the slides because you'll have it in your article, but I will tell you a little bit about the background for some of this and its implications. I wasn't able to fully explore them perhaps in the article. So a really quick background, you will get this from the article. We talk about community empowerment a lot, but we really don't have a very good way of defining it. As you will see, people define it in different ways. Putnam's social capital, collective mobilization. There's a bunch of terms that are thrown around, and mostly we talk about the right side of this pathway, the material social capital. When we talk about developing community capacity, community empowerment, we talk about developing material resources. We don't really talk a lot about the left side, which is kind of a subjective, affect-based social capital, something more to do with what goes on inside the minds of people rather than the material resources that they have. And in this, if we were to just look at this particular sex work community through the right side of the path, we would come to the conclusion that nothing has changed. There's no empowerment in this community. But they have been able to do a lot. And what drew me back to this community is the fact that they were able. It's a sex work community. It's the largest red light community at that time when I started this work in Asia. Usually HIV rates in communities, in sex work communities all over India, reach about 80%. So it's very, very, the HIV is highly prevalent, sexually transmitted diseases are highly prevalent, but in this community, it's less than 1%, okay? And every study that has been done on this community has shown ridiculously high rates of condom use, rates that are not achievable by you and me, honestly, when we use condoms. And this is quite remarkable. So what was going on in there? Some folks thought it was the fact that there was this peer education model that was happening, that this particular doctor came down, instead of doing it the way most educationists do. He actually sat down with sex workers and said, what do you want to do? How would we go about this? And they came up with this peer model of going door to door, sex workers getting trained by this doctor, and then them going door to door and training sex workers in how to use condoms, why it's important, etc., etc. So everyone assumed that that's what was working. A lot of public health researchers said that's what was working, except when they tried to replicate this model through this huge Gates Foundation project that I was involved with at Yale for 5 years, multi-million-dollar project in 7 different sites in India based on this peer model. It didn't work, because the thing is that sex workers would come back to us and say, you really are teaching us about sex and about condoms, really? That's what I mean, even if it is peers teaching us, that's not the point here. We know about sex, we know about condoms better than you do, okay? We can put on condoms with our mouth and you wouldn't know it. And you really are sitting there and teaching us about sex. This is ridiculous. And so my question then was, what was working here? What exactly worked? It was obviously not the skills, nor was it entirely about the fact that peers were talking about condoms. Something else was going on. That was what I set out to explore. And based on that, I'll quickly go through some of this stuff. I looked at it as that left side of I hypothesized, so to speak, that the left side was important. There was this concept of a collective identity. It was nothing to do with condoms, really. It was about a collective identity of sex workers. And there are some theories there, of collective identity. This particular theory, which is really, really prevalent in the social movement, collective action field, has it that, there are 3 real main elements to this. There are boundaries, which is an us against them. We know who we are and we know that you're not part of us. That collective boundary, that is an element of collective identity. There's a process called consciousness. It's pretty self-explanatory, and it's intuitive, where you infuse that with a meaning. So what does it mean to be part of this group? And then there's negotiation. And that's the aspect most often forgotten in the collective identity literature, where that identity is negotiated with the outside world. It's not just about us, it's about we telling you who we are and negotiating politically about who we are and what we want and what we do. So I went in with that framework, and in my work I found, and again, this is in the articles, lots and lots of instances. This was qualitative, initial theory-making qualitative work, where I did find that the in-group affiliation was very strong amongst this group of sex workers. We're talking about 65,000 sex workers, really, really, really invested as a collective, as a union. They formed a union. And, one worker says, I think of Usha, Mamata Care, Komal Gandhar, other SP programs. SP is the Shonagachi project, which is this collective. And these are all various programs within it. As my body parts, as much part of me as my hands and legs, they're simply inseparable from me. Another sex worker says, one stick is very feeble, 10 sticks put together have immense strength and can fight back collectively. If the day comes when all the sex workers of India become part of Durbar, then all will benefit by it. We can demand the rights of the worker. But if I say this alone, then Parliament will not listen to me. So a sense of real in-group affiliation. And these are drawn along the lines of gender and class. Gender, for example, and these are quotes that are often repeated in one way or one form or the other. I did about the interviews number, the number of interviews right now are at 250. And these quotes are really emblematic quotes. Bhadralok, or upper class gentlemen, and upper caste gentlemen too, stay with me at night, but if they run into me the next day, they ignore me. They'll call us whores, insult us in the morning. Upper class men do not understand us. These boundaries of in-group, of being affiliated, us versus them, are also along institutional lines. One worker, for example, says, I gave birth to a baby daughter in Medical College Hospital. In one of their tests, I was declared HIV positive. From that point on, no one touched me. The nurses did not give me a drop of water. While breastfeeding the baby, the nurses used to literally throw the baby on my lap. The baby was kept in a separate room. I could not understand what was going on. The hospital authorities killed my baby. And you'll find this over and over again. Sex workers saying that the general healthcare system really sucks for them. They are discriminated against, they're stigmatized. But in our STI clinics, says one of them, in our sexually transmitted infection clinics, anybody can avail of the facilities. But in government hospitals, receiving services is cumbersome. The doctors and nurses in government hospitals do not behave well with STI patients. We're much more involved in our Durbar clinic, so we never behave like that. In our clinic, there is no stigma. And SP, the Shuragashi project, is also called Durbar or Durbar Mohila Shomanaya Committee, DMSC. These are all the names of the collective. It's basically refers to the same collective. The next, so this was, us against them came out pretty vividly. What was really complicating the picture with the next stage was the fact that the meaning infused into this collective was radically different from what you and I think of when we think of sex workers. Even the concept of sex work comes out of this. We call them prostitutes. Some of you would be like, who's a sex worker, right? Prostitutes. Prostitutes was not the term that they used for themselves. Though every movement has a motto, right? Black is beautiful. Equal pay for equal work. The women's movement, right? We are just like you. Not the best motto, but that's the certain particular type of GLBT movements in upper class GLBT communities. There's a motto, there's a narrative, and with the narrative that came out in the meaning-making process, I call punctuation, you don't have to worry about the theoretical term, was that sex work is work. It's legitimate work. And at that time, in the mid-90s, this was radical. Still is, I think. So, for example, one worker says, I consider my profession good now. Through my pesha, my children and I can eat. I can pay my house rent. If a lawyer's job, teacher's job, and doctor's job is considered good, then why not mine? This is also a job. I do my work and earn my bread. I am a worker. And as you can imagine, these are the concept of work and stigmatized and destigmatizing stigmatized work is quite radical. And in India has a particular resonance because a lot of work, a lot of caste, the caste system, and this is not very different from America actually, the Americas, the caste system is based on what work you do. And the fact that sex work is work resonates and transcends just sex work. It really connects with other communities that were really kind of stigmatized because of the work they did, and in fact relegated to undercastes and untouchables. For example, one worker says, we have no religious barriers anymore. One day I ran into a client by the Ganges River. I said, hey, Boka Choda, stupid fucker, which kind of translates to motherfucker, in a nice, friendly way. What are you doing here? He said, don't you know we burn the dead here? Now that term marks them out as an untouchable, not to be touched. And that's a caste boundary. But I said, hey, whatever, let's get some tea together. And tea it's kind of a ceremonial form of respect that you pay to each other. If you share tea, that's the biggest form of respect that you can, you can share drinks and that's not okay. But tea is extremely about, I respect you and you respect me. So this man, he respects what I do, so I do the same for him. I don't care what religion says about this. So you can see this concept of sex work is work forms connections not only within the boundary, it makes meaning to have this group transcend just the sex work boundary. And hold on, why is this important for our work? I'll come to it, don't worry. And then, another form of meaning making is actually attributing good stuff to staying involved in the group. This is what we in Occupy have been really struggling to do. Why do we need to stay involved now that we've been evicted? Is there any reason to stay involved? That is called a process of articulation. That actually ensures that the group exists. Mind you, there's nothing about HIV here. Okay, HIV doesn't even come into the picture here at this point. And there is an articulation of actually it's very good for us to stay involved in this collective. One sex worker says, in the past we were controlled by our madams, pimps and landlords. We had to pay money to local parties and goons. Now after becoming Durbar members, we feel more secure. In Durbar, we now pool our money to be able to buy shops, property, save funds in the Usha co-op and take out loans. This is the way the adhere system, or the indentured labor system, which forces many to become sex workers in India, has been eradicated. And then there's negotiation. There's really negotiation of that identity to the outside world. The local goons, says one, used to extract an exorbitant amount of money from us. Through Durbar, we fought against illegal eviction and police and pimp torture. We talked to the police and the Malkins who tried to force the girl into this profession against their wishes. I want to kind of move on from this because these are all in your article, but I want to point out that this actually, we started out, I'm a public health person, I'm a social worker. What does this have to do with HIV? Well, I found that condom use was actually linked to each of these collective processes. Condoms marked boundaries. One worker says, on one occasion, a customer took the condom off during sex. I was so angry, I slapped him and yelled at him so much that he never came back. Good riddance. And this is interesting because she's losing money, okay? But she is adhering to condom use because it's about marking who we are as sex workers using condoms versus these damn customers, who are not using condoms. I kick them out if they don't use a condom. Who do they think we are? We're not that stupid. Condom use as punctuation. Condom use as part of sex work is work. The meaning, remember the meaning making process? Condom use not as an HIV, as a health device, but condom use as a sex work device. So one worker says, when the customer is erect and aroused, only then do I talk about condoms. Otherwise there might be a chance of losing the client. I encourage the customer if he wants to drink. I have better control then over using the condom. I slowly arouse him by kissing him, masturbating him. When the client is out of his mind with lust and drink, I ask him to put on a condom. This is strategy, because when the client gets excited, he's ready to do anything for sex. Aren't we all? I want you to pay attention. Why is this seriously important and radically different from the way we approach condom use? As a condom use proponent, as a public health person, each one of these, and these are emblematic quotes, each one of these totally changes the landscape of why people use condoms. Marty Fishbein, who was here, who passed away last year, was the guru of something called the theory of planned behavior. I don't know if you've heard it, but advertising schools use it, the medical school uses it, social work school uses it. That this is the rational choice, individual-based theory based on why people change their behaviors. You change their motivations, you change their attitudes, you change their norms, and then you change the behavior. That's a personal level rational choice. Cost-benefit, cognitive kind of process, according to this theory. According to this theory, that's all bullshit. I'm sorry, but that's exactly how I refer to it. And I get into fights. And Marty's the first person, and he and I have discussed this work, who would say, yeah, you're right, the process, we have really undervalued the process of norms, the collective process that builds rationality. It's a collective rationality. It may not be economic rationality. Using condoms was not an economic process. Neither was it a health choice process. It was a collective process that had to do with identity, that had to do with consciousness, that had to do with the motto of sex work is work, right? So the first one, for example, actually the second one, if he wants to drink is considered to be bad in the process of using condoms. It's a high risk endeavor, except if you reconceptualize condoms as a sex work process, because women who are sex workers are not drinking as risk behavior. They're drinking to gain control of a professional process. And so drink actually facilitates condomy. And we've seen this over and over again. They can't afford to go over their limit because they might get raped and they might get killed. Condoms are the least of it all. But because they're so professional, they realize that this is the cutoff and that's where I can negotiate condom use. This is highly transgressive if you come at it from a public health HIV educator kind of perspective. Similarly, late negotiation of condoms, right? This is again a high-risk situation. This is not considered to be okay. But that's only because we're thinking of condoms as a sex device. Late negotiation gets hot and heavy. You can't really use condoms because you lost your mind. But in a sex work situation, where sex work is work situation, late negotiation once again really ups their ability to negotiate condoms because they're professionals. They're not there for pleasure. They are there to provide pleasure professionally. That's a whole different attitude. And when we tried this, I'm going to stop the first one here. I'm going to that is really the model that comes out, that condom use in this educational process, because it is about health education, is actually a structural process. It's about the collective. It's about how, as a collective, they dealt with the stigma, the violence of the structural processes in play in that context. And therefore, the choices they make for the behaviors, for the risk reduction, or in your case, it would be educational behaviors, are not the choices that we might think would be the motivating factors. Their motivating factors are based, embedded in the collective consciousness. And it was extremely important to know. Therefore, now you can see why peer education based on why you should use condoms was not working in other contexts. It wasn't the fact that there were peers educating them. It was the fact that there were peers doing anything at all that actually worked. And in fact, now we've taken this model elsewhere. It was the collective that we needed to build. And so we have these immersion programs with this social movement. We're unionizing, right? It's a labor union process instead of an HIV education process. And that has worked really much better than the education process. So I'll stop there and field questions. Yes?
You want to start?
Yes.
It sounds from your presentation, all we can tell in a way is that you jumped in and found this this particular community, this particular, I think you used the word collective, that already had developed boundaries and negotiated their politics and so on. There must be a history to that.
Yeah, I was going to talk about that the next. I kind of inverted the two, but you're right. There is a whole history. So we walked in to figure out what worked and something that already worked. But there's a couple of other articles I can send you for later reading if you're interested about how it came about in the first place. So there's in every community there's always, I believe, especially in stigmatized communities, there are latent and nascent groups. People know each other, they network with each other, and there was that already present in this, that this collective was there. It wasn't an institutional collective, it was already there. By sheer chance, perhaps, and good motivation, the particular doctor in the mid-90s, Dr. Jana, who's still there as an advisor to the group, walked in and was able to activate those networks by the simple device of going to some workers and saying, what do you think? And then those workers said, hey, we have this T group already, and we want to get them involved. So that network got involved. Okay, this was an accident, quite honestly. It could easily have happened otherwise. He might have gone to some folks who were not part of that network, but he happened to go to 3 people who were actually what we call public opinion leaders in the community. And that was, they were visible to him, and that because they were public opinion leaders. And that network got really involved. And the network was and a lot of this happened post-network. So it grew from 5 to about 10 in the first week, and after the first week, what they determined was throw the condom stuff out of the window. What we need is folks to go to the police every time a sex worker is arrested. So, and this is the next step of building the movement, so to speak, was spectacular action. And so condoms were not part of the equation. The next week, someone did get arrested. And these 10 folks, along with a very public doctor, go and rally in front of the police station. And this becomes huge news. And she's released because the police have no idea what to do. And the guy, the doctor, is well known, so a lot of newspapers come through. We call them the political opportunity structure actors. So when there's a political opportunity cleavage that opens up, these actors who are resource, people like you and me, who go in with resources and have connections, we play a role. Next, what happened was that the next time someone got arrested, spontaneously this group went in, and Dr. Jana was not present, but this time there were 300 of them, because they all got to know about this. So this was and I detailed this out in another article, I think the second article I sent out to you. These were all stepwise building of the movement, and it was actually the highly marginalized nature of this group that actually worked, because every time there was some spectacular opportunity, they took it in hand and moved forward with it. As public health educators, as people going in, when I go to do my work in Haiti, sorry for the long-winded, because I think it's a very important question of how to do this. When I do my work in Haiti or Puerto Rico now, I actually look for these now. I know that my ultimate goal is something, but my first goal is to look for the nascent groups that are already there. To do a needs assessment, yes, but ultimately through the needs assessment to build the group along collaboratively. And to look for a moment of spectacular action that brings the visibility of that group and what we're doing ultimately to the eyes in front of the public as well as, and I use my resources now. So every time I go in, I'm a political social movement actor along with an educator, as well as an educator. So I do both things, and I go to the US news and they go to the local news. And a lot of the same thing has happened in Haiti and Puerto Rico. Sometimes it works beautifully, sometimes it doesn't. There's no perfect solution to this. So it's a great question about how you start it.
Well, I think let's open it up. Blake?
So you talked about like the collective consciousness and like the collective identity, but so it could just be with this group, but are you also looking at, you know, hijras who are sex workers? Are you only looking at women who are sex workers, or are you looking at men who are sex workers as well? Like, how does that work?
Yeah.
Because in that collective consciousness, if you say like a hijra, I would feel like a hijra can move between both networks as being the marginalized, but also being in the religious kind of auspicious type of
Right.
in the streets and being needed in those movements.
Right. And the Hijra community, who I do very close work with also, is originally when this is forming, it's a very different community and very politicized on different levels, right? For those who are not familiar with the term Hijra, it's a transgender community. It's also part of that transgender community, and transgender does not translate well, but still let's use it for the moment. It's a community that's very performative. Some of them are sex workers. They do move in different circles, religious sometimes and outside religion. But here's the interesting thing. When this became political, now the Anandam is part of the group. Anandam is the transgender community that is part of the sex worker group with lots of commonalities and lots of oppositions going on. And it's an uneasy truce because both are very performative. Women sex workers as well as transgender sex workers. Both have identity issues, that are actually, essential identities sometimes which are socially constructed, I would say, which are clashing. And that is, so this particular community has started expanding those boundaries, which automatically means the original identities become complicated. And now it has expanded to build links with the Hijra community as well as to domestic workers. So the new frontier domestic workers are kind of like almost treated like house slaves. That's the only thing that I can actually compare them to. Very, very, very marginalized and very problematic. And now this movement has started building connections with them and with poor farmers. So it's kind of branching out, which automatically raises questions as to the sustainability of the identity issue, which is an ongoing question. Absolutely, great question. Other questions?
I have two. One is, how do you identify those public opinion leaders and what are their characteristics?
Yeah.
And the other question is, you sort of talk about the publicity aspect of everybody getting politicized and protesting, but you didn't explain how does that relate to condoms as sort of a symbol of sex work? Where did that connect?
Good question. So, and it allows me to go to the fourth step that I've talked about. That, these are generalizable perhaps, but every context, necessitates change in that. One must, I think, at least I must, do the work now. I realize we went into something that worked. When we try to transport it, I realized we must do the work of excavating the conditions, the conditions that exist in the community. What I mean by that is, what are the nascent groups, right? And that means figuring out and being in the community. In Haiti, we literally, for a month after the earthquake, we put up tent in the encampment, so we lived there, That doesn't mean that we're part of the community. That means just we're trying to figure out what's going on, So about 15 of us pitched camp, some Haitian, some folks from the US, and we talked, and we did a lot of ethnographic, what turned out to be ethnographic research, but at the moment what we were doing was trying to figure out who is there, and what are they thinking, and who are the leaders, and who are the folks who might facilitate change here. What are their opinions, what do they think is going on? And from that emerges a framework of these other folks, and this is perhaps a goal, and there are some multiple objectives that come out. In this particular case, when we took this successful research elsewhere, to Bangladesh, for example, there were multiple goals. It was not about condoms or HIV. First and foremost, it was about engaging with the husbands in the community to try and change their views on healthcare. So we participated in that. HIV came about as an issue later on, as it did even here that we saw, right? What was the final question that you asked?
How the activism work into condom?
Yeah, so that emerges. HIV and anything, whether it's HIV or the others, we have to figure out a narrative to link it to the emerging narrative. So sex workers' work is the narrative that emerged here. And it's a labor union type of community here. The state has been a communist state. So unionizing around work worked here. And then we and the community worked in linking condoms to that motto, right? In Haiti, it was about condoms as part of HIV care. HIV care was a well-established narrative in the community because of the high prevalence of HIV. Okay, so condoms as a medical device in that community was not necessarily a bad thing. It was actually not condoms; it was HIV meds that emerged as a major thing. So medication was, and taking the stigma away from HIV care and linking it to medication worked there. In Bombay, where we did this next, it was anti-violence. The narrative was an anti-violence narrative because violence was the most important thing they were fighting. So condom as part of the anti-violence narrative of self-care and of collective care and of fighting back against the violence that HIV perpetrates on you. In addition, as part of the physical violence, that you're forced to be exposed to. That worked in Bombay. So all of this was excavating the meaning that was important. That was, the mottos that were salient to that community. A lot of excavation work, I call it, right? Excavation because it's already there. We just don't know. We're the outsiders. And that means the amount of time that you put in is a lot in the beginning, especially. But once the community figures it out that you're there to kind of work with whatever's there, it actually becomes very, it's challenging, but it becomes very fast. The processes move very quickly. Great question.
I'm from India, and from what I have read and heard is that working in the HIV sector, development sector, is like a business. There
Exactly.
are innumerable NGOs working.
Exactly.
Like one is sex work community. I think Amati is.
Yes, in Bombay.
Yeah.
Yes.
So there are many NGOs located in that area. So if you take the whole concept of competition between NGOs,
Right.
in terms of claiming how effective and impactful we are,
Right.
don't you think it is a hindrance in achieving collective identity? I mean, I like the concept of collective unionization, but in the current NGOization of the globe,
Yes.
how possible is this?
Very good question. It builds right into my second presentation. And indeed, you're absolutely right. It is not commensurate with the NGOification and the medicalization and the whole global welfare scheme of HIV care and work that is currently present, either in India or in Haiti or wherever, extremely problematic. And they are absolutely at loggerheads with each other. In the context of such immense funding flowing in, there are NGOs that work with sex workers that are very well funded. But, it's, I think, emblematic and kind of shows something that it is the collective that has endured and has been able to bring its rates down within the collective. Outside the collective where the NGOs are working, that's not really the case, even in Calcutta. So even in outcomes, and the collective is also working strategically with this medical environment. So it's been able to show the outcomes, which are important. Not that they're that important to the NGO itself. It's more important that they have been able to prevent violence and get the male pimps out of there, unionize. I haven't talked about that yet, but I'll talk about that in a second. But their outcomes are much better than the NGO sectors who are working in these fields, which has led some of these, the WHO and the World Bank, to go, oh, we love this, but it comes to a crashing halt when they're about to give money, and they do a lot of anti-trafficking work, for example. And the anti-trafficking is another one of those buzz terms, right? A lot of money flowing in to anti-trafficking. I'll talk about that too. But they come to a halt when they realize this is about sex work being work, that these are not prostitutes who need to be rehabilitated. So they're actually working with very, very, very few resources. All the funding that comes, you can almost track. The funding comes in, and there's an absolute non-funding zone that this community works in because they're political and they're questioning some of those same ideals that allow that funding to flow into the NGO sector. And there are NGOs, literally, physically, that operate exactly outside this realm and that are extremely well-resourced, but perhaps problematic, and we'll come to that in a second. Great question. You know this better than I do. I love it.
Well, I think one of the questions, and this is maybe a bridge to your second mini talk, you used a word that I've never heard used ever. I think it was excavator or excavation.
Yeah.
Which raises issues in my mind about where you would position on a PowerPoint excavator, instigator, politicizer, ethnographer, researcher, professor.
Yeah, totally. Great question.
Anyway, you can hold off on your answer because I think it comes up in the next piece.
Yeah.
But I think it certainly raised in my mind sort of where you are when I was imagining you in those situations, whether it was Haiti or India, places that you either were very familiar with because they were your hometown, or places that we were completely, probably very different, like Haiti. You know, where do you fit in that process? And it partly relates to what we're trying to do with this class and this course, and that is, how do people position themselves? They're all going out there to be actors. That's another actors.
Yeah.
But are we excavators, researchers, ethnographers, instigators?
I mean, excavator, I must say, is problematic in many ways, but I use that term because I realize how much of a outsider I am in all of this. Excavate assumes that there is something lying there dead, which is not my assumption.
Or that you have the right to dig.
Or you have the right to dig, exactly.
Which really seems problematic.
Exactly, very problematic. So excavate, the term that I use that really does jive with me and the way I look at it is, it's almost, and I should come up with a better term. There's a whole world that is only not visible to me because I'm not part of that world, even when I believe I'm part of that world, And it's not such an easy part of and not part of, dichotomy either, but still, that what I need to do is draw the curtains from my eyes. And though there are curtains that are there or that are shielding me from that. And I really need to spend a lot of time figuring out where the curtains are, because some of those curtains are hiding walls, not necessarily windows into worlds. They are just NGO curtains. So I'm not sure that excavate is a good term. You're right. I think it is a matter of going in and curtain drawer, personal curtain drawer. So yes.
A movement of personal curtain drawers. Oh well, we'll see.
Yes, we shall see. And it's never a process that is complete or even started, Who knows what I'm doing? I mean, I really don't. I need to constantly figure out, is this really what I want to see, or is this what is actually happening? Over the years, there's just no way to do this and come away, because that's the other accountability I think that needs to happen. You have to put a lot of work in initially, and you have to stay there and figure out what's happening, and sometimes really be critiqued and thrown out of the neighborhood. That's happened to me. And then build back some stuff and go back and see what you've done that's not jiving, that's not, And there are. It's not a community with a big C. As you said, there are hijras here. There are women here. There are subunions of pimps who are part of this union. There are husbands here. There's another subunion there. There's a subunion of children. Okay, all of them have different agendas. You might be helping one subunion, and then you might be the Western villain for another subunion, and that's happened because there are internal cleavages. So it's a really shifting terrain, and the only way to kind of ride it, I would say, is to just keep spending time there, keep figuring out, keep having conversations, and you've got to have a compass for yourself, which has to be self-critical. Does that make sense?
Let's speak for our movement. Why don't we go into the next section, because I think it's very relevant. Sort of helping that transition.
Yeah.
And I think these issues resonate somewhere in everybody here.
So I'm probably not going to do justice to all these issues. There's just a lot of them that are really, really good. That's good stuff. You know, as you can tell, some of this. How much time do I have? I just want to make sure that.
We're fine.
Okay.
We take 10, 15 minutes for this
Right.
part, and we'll open it up for discussion.
Right. So part of this, because these questions are so valid, there's nothing that is stable here, and there's immense possibility of doing harm. And even if you do help, succeed, whatever, those terms are problematic. The question always becomes help for whom, success for whom. One group's success is someone else's, chains. So it's really problematic. So one of the obvious solutions is not to do anything at all. That's the first pushback that you will probably experience in your own mind and will experience from the outside. So part of this is figuring out, I think, for myself, the terrain is one of engagement and disengagement. Because if we were to freeze, then it's the typical, that Malcolm X, in the Malcolm X incident where the white person goes up to Malcolm X and says, "What can we do?" And Malcolm says, "Nothing at all." Not because white people can't do anything, but what his point was is that if you've got to ask, that's not something that anyone can tell you. You've got to figure that out, and it's a constant process, right? But one solution to it is not to do anything at all, which I don't think is a solution for me. Number of my post-colonial colleagues, especially in the humanities, will say, "Yeah, I think that's a great solution, TJ. I think going in is colonial, period. There's just nothing you can do about it." I don't think that that's necessarily a good solution for various reasons. I'll let you answer that for yourselves. You obviously know you're in an engaged field yourself. Education and social work have the same problematic archive, and we deal with the same issues. So it's obviously a middle line of engagement and disengagement, which is why I call it kind of international disengagement. And how to navigate that line, there's no solution that I've found. I've only found a set of questions to always ask myself. And those questions become very theoretical, okay? And they may have conflicting answers, but they guide me in somewhat in at least figuring out what line I'm walking. This may be becoming too metaphorical, but let me go to, these may be things that you have already explored. But let me actually apply this to the law, the process that engages with sex work in India. This is an interesting one. The ITPA is the law. In the 60s, India had one of the most engaged and vibrant women's movements. Was one of the leaders in the women's movements internationally. You might not know this, but it's very true. In the International Women's Conference in the 60s, India, a lot of Indian feminists who were also part of the national anti-British struggle, etc., got together, and a universal anti-trafficking law was established and adopted by many of the participating countries. The US was one of the only countries that didn't adopt it. And the law said, and the ITPA comes out of that, and it was an adoption of that international law.
What does it stand for? ITPA?
The International Trafficking in Persons Act. And it's undergone lots of different names. Actually, it's called something else now because it's been modified a little bit. Now, here, the Illegal Trafficking in Persons Act, sorry. This is the law, and this has been adopted by various countries, and it's pretty much what's in effect in India. That sex work is legal. Let's not criminalize sex workers. So actually, in India, sex work is legal. But any proceeds that come from sex work that are shared, any profits that are shared by anyone other than the sex worker, that's illegal. Does that make sense? That if you're not a sex worker, profiting from your sex work, anything else is illegal. So why do you think that came about? What is the motivation for that law? Remember, these are folks who are feminists, who are women mostly, engaging in this process. force. So tell me a little bit more.
So that the idea of a pimp or a madam getting money means that they may kidnap women, kidnap
Exactly.
children,
Exactly.
kidnap people.
So
take a cut.
exactly. So this was really ostensibly an anti-pimp law, you know, and let's not, because the assumption was sex workers were usually kidnapped and put into brothels, you know, as single entities, right? And they were under the control of these pimps or brothel managers, and therefore these brothel managers would take all of that money and keep it, and that was illegal, right? Ostensibly a wonderful law and a feminist law. The problem, of course, is that 95% of sex workers in India, and this is not a new thing, this has been there for years, 95% are women with children, and women with families. At least 60% of them have live-in husbands. They live with them. So the standard, this whole idea of this brothel as, you know, as segregated sex space doesn't hold. If you actually do sex work in most countries, but especially in India, you realize that, you know, what you are engaged in, you're in an environment that is a family environment as well as a work environment, as well as sex work environment, etc., etc. And it's a complicated environment. But what this law does is now every raid that the cops engage in, they use the IEDP.PennGSE as justification for picking up sex workers. Because all they have to ask is, do you have a husband living with you? Oh, then he benefits from that, from your earnings. Do you have a child living with you? Do you have a girlfriend living with you? Many sex workers identify as same-sex people who are in same-sex relationships. Anyone, any family, and mind you, a lot of poor families in India depend on their wages. A lot of villages depend on their wages, on their living, on sex work wages, because women migrate back and forth. This criminalizes the poor in general, and definitely it's used all the time as the law that justifies raiding brothels and picking up sex workers. So this is interesting because feminism, as kind of established in the UN, does not jive with the feminism that actually plays out on the streets. So working class feminists, as I would call them, sex work feminists, have really been campaigning against the IEDP.PennGSE for years, and have constantly been told, and that is what has created the big division in sex work, that all sex work is bad. You know, it should be abolished. They abolished the abolitionist movement, which is, I think, populated by middle class feminists all across the world, and in India, and sex workers who have always advocated from the stance of a pro-sex work environment, and sex work should not be criminalized. It should be decriminalized. And that, I think, tells you the complicated terrain, I think. Nicholas Kristof, for example, has written a whole book going into Durbar, into the same community I've talked about, and talking about how horrible this is, how this is a unionization of sex workers, and the pimps are part of it, and the husbands are part of it. This is terrible. So Kristof has, in fact, he's got me on page 7 of it. We have an interesting discussion around sex work in that, and it's quite interesting because this is definitely the point of view of that middle class feminist stance versus draw the curtains from your eyes stance, where you're like, oh wow, this is not the idea of who a sex worker is, very different in my mind versus what's there on the street, and the IEDP plays on that difference and is really contested in that terrain.
So part of this,
Go ahead.
Yeah,
absolutely.
Part of this is around, maybe broaden our kinds of conversations, is around international benchmarks versus context specificity. So that people who control the benchmarks are roughly the Kristofs,
Right.
and friends at the UN and their colleagues in high-level positions, including women's rights organizations, who don't have to know the details of what goes on in the context. Part of your excavation problem is convincing people who have those power positions that context matters and specificity needs to be included.
Exactly right. Yeah. And universalism is a problem. Any standard that's based on universal processes and assumptions is always going to be, a problem. And that, in fact, is, I think,
So
you
they
know,
see you as a problem.
yeah,
You're a problem.
I'm the problem. I'm the main problem here. So going in with any kind of universalist kind of ideology just is always going to get me into trouble. And does, because we all have universalist tendencies. We all want to believe in certain. We are all value-laden people. Values itself are universal, then, you know. So I might, but the thing is, it's really kind of, you know, mind, you know what, because your values then have to be, yeah, this is this in some cases, but this is exactly the opposite in some cases. And can you make that switch? Because certainly I'm against sex work when those conditions do actually apply, which they do for certain sex workers, right? The ITPA conditions. So I want to kind of go really quickly through some of the processes of colonial practices. And again, do read the second article, it's there. One of the ways in which this works is through what Foucault calls governmentality, that governments, through conditions like the ITPA, create communities at risk for certain reasons, and then they are categorized: sex work, gay, lesbian, people with HIV. All these categories are applied, and all these laws flow from those categories, you know. And that also is an engagement of surveillance techniques. So let's see what your HIV rates are. Are you using condoms? Like, things that, you know, would be private are not private for risk category because they're considered public health hazards. And then managing. The third thing that I think, you know, is a concept of managing these needs. They're not to be ignored. We're doing this for your own good. We're the state. We're the UN. We're Penn social workers, you know, doing this for your own good. But it's not social movement that we're engaging in. We're engaging in a process of managing the basic needs for survival. So let's get the medication over there. But let's not talk about organizing as sex workers, because that's about something else. We're just medical managers. So management versus social change is the ideology used in this process. And we're managers. There's a wonderful, I've cited some amazing, much better than me, scholars who talk about this, Partha Chatterjee, Foucault, of course, the concept of governmentality and management. Cindy Patton, by the way, who is actually at Penn for this year, has written a wonderful book called Globalizing AIDS, where she talks about how the global regime of management of AIDS has really, you know, gone against the early ACT UP years of how HIV was addressed, and etc. And then we come to rights discourse. A lot of this is based on on civil rights, right? Where there's an assumption, and this is a Western, you know, civilizational process coming down from the Greek ages and through the French Revolution. I'm painting a broad swath here, that there's a civil society where claims are made and citizens are, you know, empowered citizens make claims and institutions and the state respond to those claims. All of public health or education or service provision goes with this assumption. And then we go and then look for those civil spaces. But we don't really find them because anti-colonial, you know, movements have said, no, these civil spaces don't exist because most people are excluded from it. So they go into the process, and this is where nationalist movements like in India, which throughout the British said, this doesn't apply, so we need new civil spaces, we need new nation states, we need new institutions, and these are all about us, about brown people taking over. Unfortunately, the anti-colonial rhetoric also replicates the same thing. It may be new with the new people, but the assumptions are still the same. I'm going through a lot. Do read the article. I want to talk about how this results. Wait, let me look at. I want to talk about how this results basically in an intervention process for us that I call first order change, where we become managers. We go in and provide the basic education, the basic needs, and what is really, you know, the Obama regime, and the Lewis book is a reference to a book by a social worker named Gail Lewis, who talks about how we are only engaged in just the basic need production, so that people don't die or just fall off the face of the earth. And that's what we are. We're professional, you know, our professions are engaged in management. We're professional managers. But that may blunt the larger processes of social change. And what do we actually, how how are we, and these are the questions, like I said, these are the questions that guide me. Have I become a manager, or am I involved in the social change process? That's a very important process. Have I become a surveillance agent in order to protect the non-risk population from the risky population, the bridge populations? Am I trying to protect the bridge? That's an important question for me. Am I also, and the third thing that I really ask myself, am I part of the NGO pacification regime? As you mentioned, NGOs have taken over this management regime. Most nation states do not have the capacity to even manage. So privatized NGOs run by very rich folks, drawing on a lot of money from international zones, the World Bank, the IMF, WHO, get funded to do this management work, to provide basic services, but are actually engaged in a circulation of funds between their own kind, so to speak. Because the people, as you know, the people, and Paul Farmer has a wonderful book on this, and what we've done in Haiti, how this management regime run by IMF, the World Bank, folks like us, going into international contexts, in working with the community. Working with the community becomes working with an established NGO. And the best NGOs are the ones with English-speaking folks for us who can communicate with us, because they become the proxy through whom we engage the community. Except they're also very disconnected from the community. They're also the folks who have those middle-class feminist ITPA-like orientations. So the work that they do may not be work that is commensurate with what the community is actually engaged in its own struggle and needs. So these are the questions I ask myself. Am I a manager? Am I replicating the colonial processes? Remember, social workers and educators in School of Education were the first colonialists. The British Empire, the French Empire, the Dutch Empire, those empires, the Portuguese empires, we were the first on the ground before they walked in, because we were bringing civilization and services from the west to the east. And that's, read your history, those are the first people who entered the dark continents. And so, are we still engaged in that work? That's a question I ask. And it breaks down into these three ways. We may not be the intrepid Dr. Livingstones, etc., of the past, but we might actually be managers, and we might actually be NGO collaborators, and we might actually be surveillance agents. Many social workers in international countries, as you know, probably are recruited. I was once by the CIA. Open secret, because we become surveillance agents. Literally, we become surveillance agents. And it was interesting to me, I have written a whole thing which no one has published about the whole recruitment process. When the CIA approached me saying, this blah, blah, blah. And this is not just me. I just was in the graduate council meeting this morning where the religious studies department, which was getting reviewed at Penn, 3 of their graduating students became FBI and CIA agents because they know international cultures and we can surveil them. So this is not this is scary, but this is literally what I'm talking about. But we are also surveillance agents when we do the risk work, when we identify risk stuff, etc., etc. These 3 questions then become very, very paramount to what work am I doing, right? And how can we do second order work? And I will end it here. And this is again emerging from that article that I sent you, where perhaps the second order work, which is complicating those first order colonial change intervention work, we wrote the difference between practice and structure. I'm sure this is there in education too. Actually educating versus policy, 2 streams, that both are the same, that policy and practice are exactly the same. You have to look at the structure and the policies if you're actually engaging in one-on-one intervention work. Question NGOification, I would say do not sell out to the NGO powers. NGOs are GOs. That's my motto. There's nothing non-governmental about non-governmental organizations. They are the government. They are the new government. It's only because governments can't do things that they retreat comfortably and turn it over to unaccountable private capital flowing into NGOs. They are not elected representatives of the state. So there's no accountability with NGOs. So please deviate from that and go work with perhaps CBOs, community-based organizations. And it's hard to tell. It's very hard to tell. Some CBOs, that is what Durbar is now facing. Now that they've become very famous, now they are facing the question of, are we NGO? Have we become an NGO? So very important question for them, for us, with no good answers. And of course, advocacy and collectivization have to go hand in hand with this management work. There has to be some form of real social change. And the first and foremost thing I would say to you is look for an organization that really is about the community, that is run by community members. The minute I see middle class Indians or Haitians or Americans running an organization, I know this is a problem here. The minute I see that, I know it's a problem. I just do not trust it. I don't care how good we are. We're never too good. We're always evil. So question our role. We are absolutely, it's impossible for us to really do good because our good is really evil. So always go with, I'm not saying exoticize the community, right? But a first start would be if there are community members in a community-based organization. That's the first, right? So those are some very perhaps ineffective, problematic, but it's small rudimentary steps towards really complicating this do-gooderisms that we are all infused with. We have a disease, and we're going to have to indulge it because we can't get away from it. I can't just stop doing what I need to do. But at the same time, these questions are perhaps a way to start questioning. Does this make sense? Sorry, it's like so complicated.
I think it's very much on target, and I think it is very challenging to this group because up until today, we've been, at least if you were in my class, NGOs, certainly the word evil has never come up in the same sentence as NGO. But I think this is all relevant for conversation, and that's one of the reasons. We had tried to get Torgio on our list earlier, and we couldn't quite get the date. And then I was prompted to retry again when I saw he wrote a note. I hope it's okay to say this.
Yes.
That we're on a committee together, a global health committee, and I've been used to see very dry notes. Please come to the meeting, and we got to talk with our people who are doing this and that and the other thing. And Torgio wrote a note saying, "This is all colonialist baloney." Can you just get off your high horses? I'm paraphrasing, but not much.
I should write that down. So keep that in mind.
Let's stop just dealing with the Minister of Health. Let's do work with the community-based organizations and so on. And I thought, this is, since we're often sending our students out to work with NGOs and maybe CBOs, although less so, at least in our design, and maybe with international organizations who, in fact, are the purveyors of international benchmarks, even though we engage in our own form of criticism and the limitations of those kinds of organizations. Nonetheless, I think this is very important food for thought for us, and whether, I think, part of this is back to the old conversation of, how do you see your role? I would almost, I know you've probably this has been said before, even when you come back to excavation, is excavation or being part of a political movement, is that not pushing your own perspective potentially on others? Is it more or less colonial than somebody else having a set of ideas and pushing them on others? But anyway, I don't want to say more, I just sort of opening it up. Let's have some other voices here. Fatima, go ahead. Why don't you now introduce yourselves as we go around, and maybe just where you're from and what you're doing.
I was also a student, and I'm originally from Bangladesh. Thank you for everything that you said. I'll ask a dumb question because there are more important.
No dumb questions.
But I would be interested.
A little louder, please. I can't hear you here.
Since you mentioned you look at government through the lens and talk about surveillance, I would be interested, how do you get interested to work
So, interesting question. Part of my family, one part of my family is Hindu and the other is Muslim. And I grew up in around the temple area, Kali Ghat temple in Calcutta. And it's obviously a very Hindu spot. It's one of the famous Hindu spots in all of India. And it was extremely egalitarian. It's really funny. Whenever there were riots, and every now and then we would have riots, Hindu-Muslim riots, it was around the Kali Ghat temple that it was actually calm. Because of these interesting networks, cross-religious networks. It was because of, I grew up there and I didn't even realize it was people from outside considered that a large sex work zone, but it is. Sex work, as has always historically been practiced around holy temples across India, and mosques for that matter. And precisely because of the sex work kind of orientations that I shared, it was one of the most protected in terms of collective, everyone's in it as a collective, Hindus, Muslims, etc. It was always protected in moments of violence. I always knew that. And we all know that growing up there, Many of my family members, friends are part of the sex work industry on many levels growing up. And so I always wanted to go back and kind of explore that, I had a lens of HIV because that became my work, but social movements also was something that I've been involved in and wanted to explore. That also became part of the motivating factors. I knew that in my first question, when I first went back, was what are the conditions in a collective like that keep it really calm and affect-based rather than religion, crazy religion, fundamentalist-based, which every now and then Calcutta becomes, and those were calm areas, But it kind of evolved into also a public health kind of. Does that make sense? Please.
So you mentioned in the first part of your talk the way that collective identity negotiates with the government. And the second part said the NGOs are the media. I'm wondering if you've seen examples of collective identity negotiating with NGOs successfully, whether they're actively decided for your benefit.
Yeah, it's a great question. Let me quickly take the opportunity to trace out some of the negotiations that happen. They are not negotiations with fellow NGOs, because there's a real, antipathy with NGOs and other CBOs. Durbar is one of them. There are other CBOs that work with substance users, with the Hijra community, etc., etc. I'll tell you a great example, the anti-trafficking thing. There's a lot of money flowing in from international work into anti-trafficking. It's a buzzword all over, right? Everyone's talking about anti-trafficking. And the NGO that works in anti-trafficking, actually what they do is they provide some of the money to the police. They go in, they raid these brothels and free the underage sex workers, except those underage children have been sold and then reunite them with their family. But the family has been the one that's selling them into sex work in the first place for poverty reasons. So they're back on the street the next day. In the meantime, a lot of money has flowed to the head of the NGOs and the police. But the end result is that underage sex work is still on there. Versus, many of the CBOs working in anti-trafficking, Durbar is one of them, who know the brothels and they actually have separate neighborhoods, schools, etc. for these sex worker children. That's one of the programs that they run. But they're not funded. All the international NGOs refuse to fund any of the CBOs because they're pro-sex work. They won't take a stance of rescuing, of rehabilitation. So the negotiations fall flat. There is nothing. The ideological difference between the two are really huge. But there are negotiations with the state. The state has retreated from this work because they don't have the funds. Now the state sees different possibilities of trying to engage the community that has elected them in the first place through CBOs. So it's a very interesting collusion with the state, which it remains to be seen whether they get co-opted by the state. But the Supreme Court last year, going against an NGO-informed political office called the Department of Women's and Children's Development. It's DHS, the federal DHS for India. The federal DHS has been against DMSC because of its stance because it's also NGO-infused. But the Supreme Court appointed DMSC as a guarder of rights, legal rights of sex workers in India, going against the government. So these negotiations are complex. I wish I had more time to tell you about them. They're informed by different flows of capital. NGO capital, sometimes the kind of social capital of votes that do operate in a democracy like India. It's a very complicated terrain.
I just want to clarify myself. This is a very new perspective for me. I didn't imply that NGOs are evil. I still believe they are. But what I tried to emphasize was the competition between NGOs and the synergy that is missing. Thereby, how possible is the collective identity
Right.
formation?
Which is,
For
yeah.
me, it's the competitiveness
Right.
between NGOs.
Right.
Be it even education sector. Like in Bombay, you may go to a certain slum, and there'll be a branch of Save the Children, there'll be a branch of Pratham on that street,
Right.
and there'll be a branch of some other organization. So there are different NGO branches in the same region.
Exactly. And it
So
should,
how does that
yeah.
happen in
It's a
health?
great